I am really happy to introduce our next speaker, who's going to talk about after the diagnosis that Dr. Zhang just talked about, what might happen to treat that skin cancer. Oftentimes, the treatment for these skin cancers is surgery. Dr. Bryan Carrol is a full professor at Case Western Reserve University. He's a Mohs micrographic surgeon and dermatologist, meaning that he cares for patients with skin cancer daily and is an expert in surgical treatment of high-risk tumors. He also does a lot of research focused on improving surgical methods for the comfort and safety of patients. He's made seminal contributions to the field in pain control and laboratory evaluation of tumors. Dr. Carroll is also a personal mentor to me and someone I regularly turn to for clinical advice and advice in general. So thank you, Dr. Carroll, for presenting today. Really excited to hear your thoughts on skin cancers.
Thank you, Wesley, and thank you, Anne and AIM at Skin Cancer, for inviting me tonight to talk about some of the questions that our patients have every day. So we're going to talk about the experience once you've gotten your biopsy. I have no disclosures, and I won't be talking about anything off-label tonight. So the preoperative consultation after a biopsy can happen before or during the day of your treatment. And as a physician, this emotion chart is usually what I'm thinking about as I'm meeting someone for the first time. I'm trying to figure out if they're scared or if they're unhappy. Rarely do they come in feeling confident and playful, but our goal is to move them from the uncomfortable emotions to the positive emotions. And it's our goal to check in to see what is most consuming the thoughts of our patients who've had a biopsy with the skin cancer diagnosis. And I like to divide these concerns of patients into four types of concerns. The first is comfort. Will they be comfortable during the surgery? Will they be comfortable after the surgery? Second, sometimes people are thinking only about the cancer. What does it mean for them as far as their next few hours with us with a treatment? What's going to be involved? But also, is this something that's going to be impacting their future? What is the full impact of the diagnosis of cancer? Next, some patients have their cosmetic concerns first and foremost, so they're most concerned about making sure that after the treatment, they look as beautiful as they did before. And last, we have people who have their activities of daily living and knowing whether or not they'll be able to go to the gym or whether they'll be able to walk their dogs tomorrow. Those are the things that drive their concerns. So I like to recommend to patients to think about their day of treatment like going to the spa. I know it's a bit of a stretch, but if you think about it's a day that you're going to make about yourself, and you're going to try to bring the things that you like to the day of treatment, whether it's books, music, a screen to watch video, really use the time of your treatment as something just to sort of turn off your other concerns and focus on yourself. Also want to know that different providers have different recommendations for what you need to do before. The majority of surgeons are going to be recommending that you make no changes to your daily medications. If you do have specific questions, that's something that you can call the office beforehand. Most commonly, people ask about their blood thinners. And most commonly, we surgeons tell patients not to change their blood thinners. For internal concerns, some internal surgeons make recommendations on blood thinners to stop them before surgery. But for the majority of cutaneous surgeries, we don't need to change blood thinners. Your day of surgery, very frequently, you're going to have an excision. And if it's on the head and neck, the excision is going to be this term called Mohs surgery. And Mohs surgery is the combination of surgery, an excision, and the pathology to review the tumor that's been removed and confirm that all of the roots have been removed. The most common concern of patients regarding the day of surgery is the wait, the thought about the unknown and the unknown duration for how long it's going to be between when the initial excision is done and that return of the pathology result is something that some people think a lot about. But if you start off with thinking about the day as a spa, it's more time with your book. Don't worry about what we're doing in the lab. And know that at the end of the day, we're going to go back until we have removed all elements of the tumor and make sure that this is something that doesn't bother you going forward. If you're having a simple excision, you don't have to wait for the path results to come back before we do the suturing closed, but you will still need to have the pathology report come out. Usually it's 4 to 10 days after your excision. Again, that wait is something that weighs on some of our patients, but please know that there are things that we can do if it does turn out to have deeper roots. Don't let the wait be something that you think too much about. And whatever you can do to focus on making it about you, find the things that you like, will make your day better. So this is an example of a patient who's had a tumor removed from his ear, and it's been subsequently reconstructed. And this is a good outcome for what we look to give our patients. There is some redness that I can see as a surgeon, but I bet most of the people at the grocery store or at your house of worship won't notice that this ear has a suture line on it that is still in its stages of maturing and disappearing. So to help you find the tumor or find the scar, circled in green, this is something that we, as your Mohs surgeon, as your dermatologist, our goal is to put all of the cosmetic subunits back into place. We're looking to make sure that you've got the function of all of the things that we're working on, and we're looking to make sure it's something that you, after a few weeks of healing, don't have any lingering thoughts or misgivings about your appearance and the function. If you do have anything that's still causing you some stress after 6 to 8 weeks, please reach out to us as your physician. There are things that we can do to make scars less noticeable if that's something that's concerning to you. And then finally, activities of daily living. Our recommendation is for people to rest. We don't want you to immobilize yourself entirely sitting in bed, but we do want people to take a few days off from playing golf, take a few days off from lifting weights. Light activity is always recommended. We want people to stay mobile and get around their house, walk their dog, continue to take care of themselves. But we don't want people to go and exert themselves by, lifting heavy weights at work or going swimming, things that might interfere with the healing of the wound. So it's most important for you to know that your surgical team is on call before your surgery. So if you have questions before, you can reach out to your surgeon. During the day of your surgery, at any point during your day of surgery, if there's something of discomfort, something that could be making your life better, please just let us know, because we're there to try to make you as comfortable as possible. And most importantly, in the post-operative period, if you have any concerns about maintaining your comfort, taking care of the wound, there's wound care instructions that will be provided for you at the day of surgery. You can use those to try to mitigate those concerns, to make your comfort better, or to take care of your dressing change better. And if those wound care instructions that you're given on the day of surgery aren't helping you, you can call your primary surgeon and have them give you some help and some feedback. And with that, I'm going to hand it back to Wesley.